Bulvanaka, and welcome to another episode of the FNU Pulse. And today in the studio we have Dr. Sefanaia from the College of Medicine, Nursing and Health Sciences, and he is a qualified and professional psychiatrist. So today we're going to talk about a topic. I believe everybody knows a little bit about this, but we want to delve deeper. And we're going to see a lot of this during the festive season. And that's why we here at FNU, we decided to talk about it. And we are going to talk about binge drinking and drug abuse. So, a lot of people don't really know what binge drinking is. They know what it is, but they don't know that it's an actual thing. So we're going to ask Dr. Sefa to explain, basically at first, what is binge drinking, and do you think that it's something that has become ingrained or part of our culture, especially around the festive season?
First of all, thank you so much, Crystal, for inviting us to be part of this podcast. Mental health is such an important topic to discuss, especially around this time in Fiji, when we know that there is a lot of drug use, drug abuse, a lot of admissions to hospital, and also that we know that it's affecting a lot of our younger population. Yes, indeed. Binge drinking is an issue. I think it's always been an issue.
Yeah.
Alcohol and kava and all other types of drugs that we have in Fiji, I think we tend to use it excessively, and people don't really know the limits of using these drugs. I think it's also important to define the difference between illicit drugs and drugs that people, they tend to take from time to time. But if we're talking about binge drinking today, I think we're referring mostly to alcohol.
Yes.
And I know that there's a lot of studies, there's a lot of reports about alcohol use, and there's a lot of data as well about alcohol. And I know we're coming close to the festive season, where there's a lot of festivities, a lot of get-together, a lot of parties, and a lot of
alcohol involved.
Consumptions. Yes. So alcohol is often the tricky one because, it gets people together and also can be problematic in many spheres. It can be problematic to our health. It can also be problematic to our finances and our relationships. And so it's often a tricky one. Yes. And, when to say, okay, you need help because your alcohol intake is just too much. I think that's an issue that we struggle with a lot, not only in Fiji, but in the Pacific, because we have a culture of being, of getting together.
Right.
And, you go anywhere in Fiji, in any village, you'll see people being together,
and everyone just wants to have a great time.
Yeah, everyone just want to have a great time. And usually you'll see kava.
Yes.
Or you'd see alcohol, and it's fun.
Yeah.
So the question is, how excessive should excessive be?
Yeah.
And when do we say, okay, this is enough, this is too much?
Right.
Yeah. So there are many things that we can talk about alcohol before we even think about other drugs, illicit drugs. Yeah.
So do you think that people who have grown tired or, have reached a certain limit of alcohol consumption are now looking towards drugs to feel a certain level of relief?
Yes, I guess when we talk about drug use, people often start with something that is less harmful, less, people often start with smoking. If you look at inhalants, okay, so we often see this, from children. They probably use, rolling up pieces of paper, and then
you had loads of pencils and all of that going. Yeah.
And experimenting on that first, and then, okay, why don't we try suki? So you get tobacco leaves, and then you roll it up, and then why don't we try something even more fancy? So you go on cigarettes, and then usually the progression is like that. Hardly you come across somebody who tries marijuana, on the go. And so, so people often tend to start with something more harmless, and then they go on to something more harmful. So we see that across, not only in the Pacific, but across the globe. And there are many, many reasons why people use drugs, as you're aware. It comes from all aspects of life. People often struggle with personal issues, or it could be something public as well. So we can sit here, we can talk about all these issues. Yeah, but we know that resorting to drugs as a way to cope is not always a good thing.
Yes.
Because how it can impact a person's livelihood. Okay, so yeah.
So let's talk about that. Talk about the reasons behind why people take drugs. A lot of people usually think that drugs helps relieve, their stress, or helps them improve their self-esteem, or gives them the confidence that they need. But coming from your point of view as a psychiatrist, do you think that there are other reasons also linked to drug abuse, especially now, this day and age in Fiji? Because we're seeing young people as young as, students in primary school now resorting to drugs. What do you think is the reason behind it?
I think, let's be honest, that the drugs that people use helps them. It does help. It's a performance enhancer. It helps people to be alert, to be able to complete their tasks. It helps keep their mood up, because these drugs, they actually do something in the brain that helps with mood, it helps with motivation, it also helps with memory in the short term. The problem is when there is chronic use of these drugs, and that will lead to eventual burnout, and then you'll see that it also burns out every other aspect of the person's life, including, as I mentioned before, the ability to connect with people, the ability to manage finances, and the ability to concentrate in whatever task they're given. So, yes, now you are asking the question about why is it that young children are resorting to drugs. What do they stress about?
Yeah.
I mean, when
we were kids, the only thing we were stressed about is, oh my God, am I going to get lunch tomorrow? Or what's my mother making? I hope it's not pumpkin. You know what I'm saying?
Yeah.
But what are these people so stressed about now?
The thing with the young children is, we worry about modeling, experimentation. They see people doing it. It's why don't we try it out?
Yeah.
And peer pressure. That's often the most highlighted reason why, young children resort to drugs. And I think in a very close-knit community like Fiji, it's not that hard to get things going around. If you go to school and you have, particularly in rural settings, or, in a close community like ours, like Rewanga, Cunningham, where each other and the neighbors, it's very easy to adopt behaviors.
Yes.
As soon as, let's try that. Okay, let's all try it. Again, Fiji, and likewise in the Pacific, we have a very sharing culture.
Yes.
If somebody has something, you got to have it too.
Yeah.
You go to any community, if somebody is not having anything, okay, let's get something for that
them.
person.
It's just so inbuilt in our culture.
It's so inbuilt, and you can see that in the way we use, sorry to say, drugs, because now I'm including cover in it.
Yeah.
Cover, you go in a sitting, if somebody is not drinking, people will be looking around and say, why isn't that person drinking? He should be drinking, he's not part of the group of the group if he's not drinking, so that. And
then there's always that thing, they're like, just one bowl, just the bula bowl.
Oh, absolutely. And then, because it's equated to fun.
Yeah.
And if you're not drinking in the group, you are boring, you're not having fun. And so the rest of the group will go, we got to do something to get that person to drink.
Yes.
And you see the same thing when people share a smoke.
Yeah.
If somebody is having one roll of cigarette left in that group, they would share that smoke amongst themselves until it finishes. It's called peace piping.
Yes.
It's a culture of sharing. Unfortunately, that culture has been brought onto the way we use alcohol, the way we use illicit drugs these days. And so, everybody has to have a share of love, in sort of a...
Which sort of led to the culture of Bluetoothing.
Yes, absolutely. Yeah. So you see that this is steeped into our own way of life, and unfortunately it rubs the wrong way. Because then people start getting into trouble, like for example getting into addiction, and then having to have mental health issues. Mental disorders, and then by then, now it's very difficult to deal with.
That's very enlightening. It's great to know about, I never thought of it through that perspective, how, the culture of our sharing, culture of our communal, gathering has led to this issue, just blowing out of proportion. So we're going to continue this interesting conversation with Dr. Sefa straight after this break, so please don't go anywhere.
Get ready, Fiji! The Fiji National University Roadshow team is hitting the road, and it's coming to you. Discover programs designed to power your future with tailor-made courses for everyone. We will be in Nausori, Navua, Singatoka, Ba, Tavua, Rakiraki, Lautoka, and Nandi. So catch us at a town near you from the 11th of January to the 1st of February. Dream it, live it, and achieve it with FNU.
Welcome back, and we're in conversation with Dr. Sefanaia, and we're talking about binge drinking and drug abuse, especially amongst young Fijians. So, sir, tell us the truth up front, nothing but the gospel truth. What are some of the bad effects, and I'm talking short-term and long-term, of drinking, binge drinking, and the use of overuse and abuse of illicit drugs?
Right. I'll start first with binge drinking, because I think you're putting two big topics there. So drinking and illicit drugs. Illicit drugs now, I'm here referring to methamphetamines, cocaine, so the ones that we're hearing that are in Fiji now. Now, let's start with binge drinking. So drinking, again, referring to alcohol. I'm not going to touch kava. I think that needs a topic of its own. I know that we consume kava quite excessively in the Pacific and in Fiji. So with alcohol, we know that, to drink alcohol, you're drinking excessively if you're drinking 3 to 4 drinks per day in the week. Okay, so that comes to roughly around 21 drinks per week. Okay, so this is a study backed up by studies. So let's talk about drinks. So one drink, you've heard about standard drinks. Okay, so one standard drink is equivalent to, say, 1 can of beer, 5% alcohol content. So 1 can of beer, say, for example, Fiji Beta, they have that can, or 1 stubby, that's one standard drink. So excessive drinking or binge drinking would be equivalent to, say, 21 stubbies in a week. Okay. So 21 stubbies, you can spread it out. You can say 3 stubbies per day, but as long as it comes to that, 21. So that 21 to, say, 25, if you're consuming more than that or more than that, you will be classified as somebody who's drinking excessively or having, binge drinking practice. Now, it's also important to point out that there's a difference between binge drinking and alcohol use problem, or alcohol use disorder that needs treatment. So binge drinking is a one-off thing. Okay, somebody who's just walking about probably may never have consumed alcohol, but then in one sitting consumed, say, 21 stubbies of beer. Now that's, that can lead to a lot of problems, particularly health problems. Now, how does that impact a person's health? That's the next question. Now, we know that alcohol has a lot of issues in terms of impacting the way we think, the way we feel, and the way we think as well. Okay, so I think think, feel, and I think relate with other people. Sorry, I think I messed it up. Now, it's been found in studies that alcohol causes damaging of the neurons, of the nerve cells in the brain. So it can cause problems with memory. It also can decrease the volume of the brain. So these are studies, research that have found that. And we know that if you're having if you have alcohol use problems, we anticipate that you'll have memory problems too later on. So apart from that, we also have issues about, behavioral problems. They often come at that one sitting.
Yeah.
With that, you can also have your poor judgment. With poor judgment comes susceptibility to unsafe sex, and also have higher probability of getting pregnant, falling pregnant. And so these are, findings that that's been published out there. And it doesn't take a genius to figure that out, so also, in addition to that, there's also higher rates of violence.
Yes, we've seen that on the street.
Yeah.
You just have to come down to like Suva on a nice Friday night and just going past, that particular strip of road. Everybody knows what particular strip I'm talking about. And there'll be just people just beating up each other just for no reason.
Yeah, absolutely. So that's often the danger with excessive alcohol consumption. And it really can spoil a lot of relationships too. So, yeah.
And so what about illicit drugs like you're talking about? Hard drugs, as we like to refer to them.
So let me just go back on the history of hard drugs. So in Fiji, we never used to see ice. And I think the first case of methamphetamine that I came across, I think, was probably 2014 or 2013. This was somebody who actually, wanted to quit meth, and so came to the hospital, wanted to, seek advice on how to do that. And it was very new to me because we've never heard of it to come over to the hospital to seek treatment. But I believe it has always been around. The people, haven't sorted. Yeah.
It was like hush, hush, under the wraps, and nobody actually knew it was existing. Only the people who use it knew where to get it and who to get it from. Yeah. But now it's readily available everywhere, I believe.
Yeah, that's absolutely true. And we've seen a spike of use after the COVID period. I also work at the hospital at St. Giles and CWM. And so we've seen that now a lot more people are coming to the hospital because they have mental health problems. When I say mental health problems, they're having psychotic symptoms, mood symptoms. When I say psychotic symptoms, they're having delusions, they're having hallucinations. They are not able to regulate their mood. They're not able to sleep. They're not able to carry on with their day-to-day normal function because, they're so dependent on these drugs that they're finding it difficult to quit. And so this is unfortunately a very sad thing to see, over the last couple of years. Because this was never a thing for us to see at the hospital.
Absolutely.
And it's a worry because it's affecting our younger population. And we know they have so many years to live. And now that they will be dependent on our system to make sure that they are well and they're able to live normal lives. And in Fiji, we're still having issues with mental illness, stigma.
There's so much stigma around that, yes.
And we know that we are a developing nation. And unfortunately, that's something that we have to fight with on a daily basis. And I feel like we are finding it difficult to catch up to the demand of our service because there's just so many people.
Right.
And there's not enough facility. There's not enough doctors. Just to let you know that there are only 4 registered psychiatrists in this country.
Wow.
And you have this many number of people that are seeking our service. Yes. And, talking about the facilities to meet these challenges, that can be another topic for discussion.
I know, because we know there's a lot of, news going around about how St. Giles is now struggling to keep up with the number of people who are reaching out to seek help. Let's talk a bit about that. Do you think that now people are realizing that it's not just, the stigma attached to St. Giles, is slowly being removed, because people are realizing that you can actually help save so many lives. But like you said, you don't have the resources.
Yes. So the stigma, let's talk about the stigma. I think we've been struggling with stigma for a very long time.
Yes, from the
but
longest.
Just recently, with increasing drug use, people are now, questioning, how else can we manage this problem that seems to be just coming on and on, and you can see this everywhere. And I think everybody in the country is trying to find a way to address it. I think that the government is also trying its best, to come up with solutions. But looking at the demand and what we have at the moment, I think there's a big mismatch. And unless if something is done sooner, then I think the trend will continue. And I think that the future looks kind of bleak. That's the way we're seeing things, especially when it's in our schools. Just today I was listening to the news, and I heard again highlighted in the news about drug use in schools, and I think this will be something that we'll continue to hear for the next couple of years unless we do something about it.
Right. So from what I can tell now, that the initiatives that are currently in place are not working, right? They're struggling. You're struggling to keep up with the influx of requests that you're getting by people to help them. There are people who are seeking help.
Yeah.
Now, so my next question, and I believe this question would be in everybody's mind, what next?
Yeah.
Who are you looking to next to help solve this problem?
Okay, thank you so much for the question. And that's what I was really looking forward to that question, because I was going to say that the School of Medical Sciences under the College of Medicine, Nursing and Health Sciences, we have started a Masters of Psychiatry program this year. So our first cohort of students actually started this year, which is going to run for the next 3 years. We know that when we have the manpower, then they will be able to map service delivery.
Yes.
Right? Like I mentioned before, there are only 4 registered psychiatrists in this country. So if you look at it, taking it from our last census of about 800,000 population in Fiji, that's equivalent to 1 psychiatrist per 200,000 people. And that's just not working out.
Yeah, that's definitely not going to work out in any way.
Because half of the time we're just trying to see our patients, and we have no time to plan ahead. What else do we need to do? Because we're all occupied to just trying to figure out how are we going to look after all these people who are in the hospital. And so by having the program, we are ensuring that in the next 3 years we would have some qualified professionals who will then look at different areas within the health system, particularly in the mental health system, and then try and develop and take lead in figuring out, planning out how we're going to address all these concerns.
Yeah, because we desperately need it.
Oh yes, we do.
And I think the Vice Chancellor earlier this week, while she was at the PCMS new building opening, had said that FNU is here to work with the government to address this type of issues. Yeah. And I'm so glad that CMNHS is taking up the mantle and deciding, that we're going to solve this issue for us, for our country. And just on that, sir, can you tell us a little bit more about how you can qualify to be in this program?
So to get into the Master of Psychiatry program, first you have to have an MBBS degree.
Yes.
And so from there, then you will then have to do the postgraduate diploma in psychiatry, and then you then be eligible to apply for the master's program. So in total, it will be about another 4 years after you graduate from your 6 years of MBBS. So looking at the number of graduates from the MBBS, so we have students from FNU, we also have students from the Uni Fiji, we also have students coming from Cuba, from China, so they can all apply to do the postgraduate diploma program. And in order for them to do that, they have to be working at a Fiji mental health facility, so that can be at St. Giles Hospital or at the stress wards of the divisional hospitals. and then they will be able to enroll for the course. Now, it's a very small pool of people, but we are hopeful that we'll get the numbers.
Yeah.
I think there's a lot more advertising and a lot more. But also, just to shed a bit of light on this program, we're also working together with the College of Australia, New Zealand College of Psychiatrists, who send their experts, for subspecialties like addiction, child and adolescent psychiatry, forensic psychiatry, who come over to do some teaching for our cohort of master students. So that's another, great thing.
That's good to know.
Because it's important. While we know that we have a problem with services here in Fiji, it's also important that we take outside perspective.
Yes.
Have that kind of exchange of ideas of how we can better manage our services here.
Right.
Yeah.
So finally, I'd like to ask a very important question.
Yeah.
How can parents, especially during this festive season, be able to protect their children from the dangers of binge drinking and drug abuse?
Right. I think that's an important question. And I think, challenges of now is a lot more compared to years before, especially with the rise of, social media.
Of course.
People are more connected than ever, and it's very easy to find out what's going on, just the street down from you or
Yes.
from across the world. And so I think, parental supervision, I can never overemphasize the importance of getting to spend quality time with your kids. You might think that but really, if you really sit down and have a good heart-to-heart session, and then you find out that there's more to it than what you just see or what you hear. And I think that's really important now, that parents spend time with their children, and know them fully, know about what their struggles are, what are their, what makes them. The other thing that I also wanted to mention is a high rates of depression that we are also getting to see, particularly from young children.
Wow.
And I think this might be one of the reasons why people also, I think it is one of the reasons why people use drugs. And, these things can be avoided, if parents sit down and have a chat with their children about it. And a lot of times parents talk down to their children or talk at their children, but not really having that, listening quality where you have, really quality listening, where you sit down and really hear their children, what they're trying to say. And children, they communicate in many different kinds of ways.
That is true.
It's not always verbal. Sometimes you'll see them acting out or behaving in a particular way. But it's upon the parents to really,
intervene.
Take that in and go, what's going on? What should I say? Is it something that I said? Or should I take a bit more time to, explore this? And let's be honest, not everybody went to parent school or had a degree in parenting. And so a lot of things, unfortunately, it's trial and error. And a lot of it is just your observation and just being present, being there 24/7 and being in tune to what the children or what the child is going through. Yeah.
And I honestly believe that spending quality time with your children is not just about sitting together at a dinner table and sharing a meal together.
Absolutely.
It's about knowing how their day was and being genuinely concerned about it, being genuinely concerned about what your child is interested in. Because a lot of times, even our parents and guardians and all of our elders, they're so busy with, life.
Absolutely.
Being able to provide. But it's not just about providing food on the table. It's also about providing the support that your child needs.
There's this concept about minding your child or minding someone, meaning like if someone is sitting there, you try and sort of imagine what might this person is thinking or what they're going through. And then that leads you to go, maybe I should ask this question. unfortunately, a lot of people don't have that skill.
Yeah.
They just take it as it is and they'll, okay, off we go. But if you take a step back and try and connect the dots and you sit down and ask the right questions, then you'll be getting somewhere.
Yeah.
And I think that's a very useful quality for parents to have, especially when their children are on that developing phase. So until they get to a more mature age where they can relay their feelings and their thoughts, then we are all good. But with children, there's often that difficulty of relating what their inner feelings and what their inner struggles are. And so I think that's where parents need to step in and try and work things out. Yes. Not in a judgmental way, but in a more, loving understanding and
yeah. So thank you so much, Dr. Sefa. We had such an interesting time talking with you. We're hoping to see you again on our show. Maybe we'll talk a little bit more about kava, or we'll even talk about mental health. Thank you so much for taking out your time once again. And to everyone that's watching, if you know that you have someone who is struggling with binge drinking or struggling with drug or alcohol abuse, please seek out for help. We have people out there who are ready and willing to help you. So would you like to share any other contact details that you have for people who are seeking help?
So mental health is important, and I think it's important that we all look after ourselves, know when to say enough is enough, particularly when it comes to, drinking alcohol, and always talk to somebody. Yeah. If you're going through something, there's always someone out there that will be willing to listen. If you don't have that someone, our services are available. You can come to St. Giles Hospital. We have a 24-hour outpatient department. We also have the stress management wards at the divisional hospital, or you can just go to your general practitioner, your doctor, your family doctor that you go to every now and then. You go to them and you tell them what you're going through, what the struggles that you're going through, whether it's about drugs or quitting alcohol, or if you're having depression, and they will make the referrals to the specialists so you can have that one-to-one consultation.
Thank you so much, sir. Thank you to everyone who has been watching us, and we hope you have a wonderful time with your family this holiday season. Be sure to stay safe and take care of each other. Naka.